The US healthcare industry makes $4.5 trillion a year. To put that into context, that's more than the entire GDP of Germany. And the most valuable thing inside that industry isn't a drug or a device or a treatment. It's information. Your complete medical history, your diagnoses, your lab results, your prescriptions, your mental health records, your genomic data, all of that is worth more to the right buyer than almost anything else about you. And HIPAA has always been the law that has kept that information yours. But there is this one legal workaround that is built into that law, and one company has spent the last several years secretly positioning itself right inside it. Hi, I'm Dre, and this is the Dre Dossier. Welcome if you're new, and if you're returning, where have you been? I missed you. Look, I've been covering Oracle's data and surveillance infrastructure for quite a while now, and I have to say that this is one of the videos that all of this has been building toward. Because today, I'm going to be walking you through exactly what Oracle has, how they got it, and why the protections you think you have may not be doing what you think they are. Now, I'm going to need you to strap in for this one, okay? Because Oracle recently just bought a company that stores your medical records, and they're already trying to sell that company off, which to me raises a pretty obvious question. If they don't want the healthcare company, then what did they want all the healthcare data for? Well, I think I found the answer to that, and I don't think any of us are going to like it. Like always, all of my videos are paired with a written article on my Substack, the Dre Dossier, and at the bottom of that article will be all of my sources cited, indexed, and linked, because I don't want to tell you what to think. I just want to show you how I got my answers. Now, fair warning, what we're about to talk about is more than likely going to make you very angry. I'm not going to sugarcoat that. However, I need you to trust me, okay? Because I'm going to give you something very real you can do about it at the end of this video, okay? Something very specific, something that we can actually do to create pressure about this right now. I even built a little interactive page for it, okay? I taught myself how to use GitHub just for the occasion, all right? So stay with me here. So Larry Ellison founded Oracle in 1977 and has been one of the most powerful men in American technology for nearly 50 years. And he's been my nemesis for the better part of 3 years. And even if you haven't heard of Oracle, you've probably still used what they build. Oracle makes the database software that runs behind basically everything, from banks to hospitals to airlines to most of the federal government at this point. And the entire business model has more or less been built around the same idea, managing massive amounts of information about people and then selling the tools to access that information. And it just so happens that the most recent iteration of that is through healthcare data, through the acquisition of Cerner and through Medicare and Medicaid contracts. Now, this isn't old Larry Berry Puddin' Pie's first swing at healthcare either. You know how most billionaires eventually come to the conclusion that death is a problem that money can solve? Well, Ellison decided that the real opportunity in healthcare was earlier than death, while you're still alive, by reading your biology before you even got sick. For example, one of his early personal bets was in a company called Theranos. Maybe you've heard of it. It's the company that claimed it could diagnose hundreds of diseases from a single drop of your blood. Now, spoiler alert, Elizabeth Holmes turned out to be a fraud and the company collapsed, but the investment, I think, tells you something about what he gravitates towards. Another investment being in May of 2022, he put $21.5 million into an Israeli startup called Imagine AI. And Imagine built these AI algorithms that could read biopsy images and detect cancer mutations within about 2 minutes instead of, waiting the several weeks. And so every healthcare investment that he's made personally all follows the same logic. Biological information about you read earlier and processed faster. Larry Ellison had been trying to build AI tools that could read and analyze medical records for years now, and the trail of failed attempts tells you exactly how badly he wanted it. In 2018, he even co-founded a company called Project Ronin with oncologist David Agus, the same doctor who treated Steve Jobs. And the idea was to build a software that could plug into any digital record systems that hospitals already use, like Cerner and Epic, and it would analyze patient data in real time to help oncologists make better treatment decisions. Because you know how much doctors love unsolicited advice from a database company? God, I cannot count the number of times that I've been in a doctor's office and thought to myself, good God, can we just get a database company in here already? Jesus, get a load of this guy. Am I right? Or girl. Anyways, it ran for about 6 years and hospitals weren't really adopting it. Shocker, I know. And in March of 2024, Project Ronin shut down and laid off 150 of its employees. Whoa, wait just a darn minute here. Sorry to interrupt your regularly scheduled programming, guys, but I was pulling together some assets as I'm editing this video, and I went to go pull some assets for Project Ronin, which is hard to find before 2024 because it was a 2018 company that Larry Ellison had. It was here, I'll show you. As you can see, this is the Project Ronin Cancer Intelligence for the N of 1. N of 1? I hope that doesn't have anything to do with N1 Neuralink's N1 chip. No, it's different. I'm gonna flag this though, just in case. But again, it looks like just a dead startup because you can't even find on Crunchbase anymore Project Ronin as a startup. So I just, whatever, figured this was from the archives. So I clicked on this, Project Ronin launching soon. What do you mean launching soon? 2025? Project Ronin? Oh boy. And so it was at this point in time that Larry Ellison must have been realizing how hard it was to penetrate the healthcare system. And he realized that he couldn't get access to the data that he needed without owning the systems that the hospitals already ran on. So he bought them. And the Cerner deal acquisition closed on June 8th. And just 2 days later, Larry Ellison was on stage at Oracle's financial analyst meeting laying out exactly what he planned to do with your medical records. And most recently, in October of 2025 at Oracle AI World, he told investors in a keynote that Oracle's databases basically have all of the high-value private data anyways, and he described all of these AI agents that would connect to all of these patient portals and hospitals and insurers and regulators, and he'd automate all of it in one system.
Following Elon Musk's rule that if we really want to be successful in healthcare, we can't just automate hospitals and clinics. We have to automate the entire ecosystem. If we want to automate hospitals and clinics, those hospitals and clinics are not going to be very efficient if the people who regulate those hospitals and clinics are not also automated. If people, if the patients who are making appointments or receiving the results of a blood test and all of it, if the patients are not also have access to that automation technology, you have to automate the patient, the provider, the payer, the regulator, the pharma companies, banks who finance the hospitals, and governments who again regulate the hospitals and collect information from the hospitals. You have to automate the entire ecosystem. Then you will get a truly modern, efficient healthcare system, and that's what we were after when we bought Cerner as a first step. From the hospitals, you have to automate the entire ecosystem.
Watching that back, I'm sorry, it's just like, I haven't watched this keynote since like November or so when I first watched it. And I remember how crazy it sounded the first time. And it sounds just as crazy. You know what's crazier about it now is that he told us what he was going to do. He said, hey, here's what we're going to do. And I remember kicking up a lot of sand and thinking, oh, well, the government has to do something about this. I mean, he's saying he's going to automate the government, automate the healthcare, automate the patient, automate every element of this process. And the government has done nothing. Not one thing. Now, this at the time was the largest acquisition in Oracle's history. If you've ever been to a hospital or a clinic and a doctor has pulled up your chart on a computer, there's a decent chance that the software behind that was built by Cerner. Same goes for doctors at military bases or VA physicians. Most of them use Cerner as well. I mean, their system ran across more than 14,000 medical facilities across 24 countries, including the VA, the Department of Defense, the CDC, and dozens of NHS hospitals in the UK. And it had taken the company decades to embed itself that deeply into places where your most sensitive information lives. That is no small feat. And just 2 days after that acquisition closed on June 10th of 2022, Ellison hosted a virtual briefing called The Future of Healthcare. And this is where Ellison announced that Oracle would build a national health records database pulling anonymized data from thousands of hospital systems across the country and essentially would be training AI on it to monitor and diagnose diseases. And I guess this wasn't really that alarming to anybody, The plan was stated basically 2 days after he got the keys and we just let it happen, So that's cool. Now, as I previously alluded to, one of the most important pieces of Cerner's business was its contract to the VA, which is the Department of Veterans Affairs. And the contract was to modernize the electronic health record system that was used by millions of veterans. And that alone was a $10 billion contract, by the way. And from the moment Oracle took over, the situation deteriorated. In 2024, the VA's own Inspector General documented that there was a scheduling error in Oracle's system that contributed to the death of a veteran in Ohio. A few referrals got lost in the software, and he didn't get the help he needed in time. When the VA surveyed its clinical staff, 58% said that the system increased patient safety risk. By that point, the estimated cost had ballooned to $37 billion, and they had only reached 6 hospitals out of 170. Oracle lost 74 hospital clients in 2024 alone. The first year, they refused to even share their client list with industry analysts. Key executives were sent to Cerner to fix some of these problems, but all of them basically left by early 2026. I mean, if your goal was to build the best electronic health record system in the world, or at least a halfway decent one at that, then none of this would make any sense. Unless, I don't know, fixing the system was never actually the point. Because while all of that was happening, Oracle, according to its own remarks, built an entirely new health record system from scratch, not based on any of Cerner's original software.
Rebuild the Cerner code, the Cerner code base. We can rebuild the entire Cerner code base, modernize it using AI, build a modern version of Cerner by generating it. And we got all of the code for clinics operating already. And next year, we'll have all acute hospitals. We'll have rewritten everything that Cerner wrote over a quarter of a century. We'll have rewritten in 3 years.
And it runs on Oracle's own cloud. It sits on top of Cerner's data, and it learns from all of it. And once that migration is complete, the old Cerner software isn't needed anymore. So when Oracle talks about potentially selling Cerner, what they mean is that they'd keep all of the data that they got from Cerner. What they'd be selling off is the old system and the liability that came with that. Okay, so where does that leave us now? Well, in January of this year, 2026, TD Cowen published a research note suggesting that Oracle should consider selling Cerner. Remember, they paid a whopping $28.3 billion for it less than 3 years ago. And you don't walk away from a $28 billion investment unless you've already gotten what you came for. And selling Cerner is not just as easy as putting it on the market, because the VA has announced that it is restarting deployments of 13 new sites beginning in April. Detroit, Saginaw, Ann Arbor, Battle Creek, and facilities in Ohio, Kentucky, Indiana, and Cleveland. And so veterans at those sites would have their medical records mid-migration as the sale happens. Not safely stored, mid-migration, being moved from one system to another that hasn't been named under terms that haven't been disclosed yet. Lest we forget, these are veterans whose healthcare is being moved onto a system already linked to patient deaths and safety failures, run by a company under financial distress, according to this bank's suggestion, although its quarterly reports would say otherwise. All being moved and migrated onto a system that may not have the same owner by the time the migration is finished. Look, I shouldn't have to say this, but our veterans deserve so much better than this. I mean, the government calls them heroes, puts them in harm's way, and then hands their medical records over to a tech company who's trying to figure out how to make payroll. Now, let me walk you through 3 things Oracle has done since buying Cerner. In November of 2025, Oracle received a federal designation as a Qualified Health Information Network. Here's what that means. Like, your cardiologist sends your file to your insurance company, a hospital transfers your records to a government agency, or a specialist requests to view your history, anything like that. All of those records travel through a federally regulated system. Think of it as like a highway that medical data travels on. Well, Oracle just became the toll booth on that highway. That means that Oracle doesn't just store records for hospitals that use its software. It can now see medical data moving between doctors, hospitals, insurers, and government agencies, even when none of those parties use Oracle's products. On February 11th, 2026, CMS, the Centers for Medicare and Medicaid Services, awarded Oracle the contract to host and modernize its core technology systems. And that covers Medicare, Medicaid, the Children's Health Insurance Program, and the ACA Marketplace. Programs which, by the way, serve more than 150 million Americans. So what does CMS give Oracle that it didn't get from Cerner? Well, Cerner gave Oracle clinical records, so what happened in the exam room. You know, all the things your doctor clippy claps about while you're in the room. But CMS data, well, that's different. It's all of your claims data. So the financial record of all of your healthcare, basically. It's every procedure billed, every prescription filled, every diagnosis coded for reimbursement, what it cost, and who paid. And together, they add up to something that has never existed before in private hands. A complete picture of what happened to a patient's body and what it cost the system inside a single company's infrastructure. Okay, now here's a date I need you to hold on to, okay, because it's important. On January 29th, 2026, just 13 days before the CMS contract was officially announced, Oracle launched its own Life Sciences AI data platform, which is a commercial product that gives pharmaceutical companies, device manufacturers, and insurers access to 129 million de-identified patient health records. Yep, complete medical histories spanning years. And this could be for a number of things, right? For drug development, clinical trials, and coverage and pricing decisions. Hold up here. Let's go back to that last one, the coverage and pricing decisions. Let's stop on that one for a sec. Because if an insurer can buy access to millions of complete medical histories and run AI on them, they're looking for patterns to predict, who will develop expensive conditions and who is statistically more likely to cost them money. Then that changes how insurance works. Does it not? Let me give you an example of what I mean, because let's say you were treated for depression when you were 27, okay, and you got better from it. You went to therapy and everything feels okay now. You moved on. Under the Affordable Care Act, an insurer cannot deny you coverage because of that. That's a law. But under whatever all of this is that Oracle is building, that insurer can build a predictive model trained on millions of records just like yours. And that AI model could run pattern recognition and say that people with your exact medical history cost 40% more over the next decade to insure. And so insurance companies price your premium accordingly. That's what I mean by this changing insurance. They didn't deny you coverage, no, but they did make it more expensive to be you. And again, that product launched 13 days before the contract that would add 150 million more Americans to that data set. Before I tell you what we should do about any of this, I need to answer the question that you're probably already asking. Yes, your healthcare data is protected by HIPAA. It's been the main legal framework protecting your medical privacy since 2002. But, and this is a big but, that law was written before the iPhone existed, okay? Before social media, before anyone could conceive of the idea of training AI on health records for an entire country. And here is the specific gap that Oracle just walked right through. Because the loophole here is that HIPAA allows something called de-identification of data, meaning that if you remove 18 specific types of identifying information from a health data set, like names, addresses, social security numbers, birth dates, phone numbers, and so on, that data set legally no longer is considered protected health information. So it can be sold, shared, and used without restriction. No patient consent required, no notification, no limits on what gets built with it. And the reason in 2002 everybody accepted this was under one assumption, that once you stripped out 18 identifiers, that whatever remained could not be traced back to you. But that assumption was incorrect. That was wrong. It was really wrong. In the late 1990s, Dr. LaTanya Sweeney at Harvard took de-identified hospital discharge records from Massachusetts and combined them with publicly available voter registration rolls, which cost about $20. And just by using 3 pieces of information, a date of birth, a zip code, and gender, she was able to re-identify the medical records of the governor of Massachusetts. That was the 1990s. What? She was able to identify data sets that were his diagnoses, his prescriptions, and his doctor's notes. Oh, but it gets better because she then found that 87% of all Americans can be uniquely identified using those 3 same fields. And you'll never guess what 3 fields are routinely left in de-identified data sets because HIPAA does not require them to be removed. I mean, HIPAA's de-identification rule was clearly designed to protect you from a human with a couple of spreadsheets going around a filing cabinet, like a Doge intern shuffling through a cabinet of paper trying to find some data to feed Grok. It was never designed to protect you from a machine that could cross-reference behavioral data, purchase records, location history, Medicare claims, clinical records from 1,400 hospitals, and the activity logs of 170 million TikTok users, and find matches for all of those within seconds. And Oracle has all of those data sets under the same roof, and all of this running on AI systems that Ellison has described himself as being designed to reason across private data. Oh, what a weird thing. We want all of our private data private. Oh my God, it's not like billionaires like having privacy, right, Larry Ellison? And Oracle might say that all of its data is de-identified before it runs any AI across it. And under current legal standards, sure, that might be true. But de-identified doesn't mean today what it meant in 2002. All it means is that 18 categories of identifiers have been removed. That's it. It does not mean that you cannot be found. And the company determining whether or not the de-identification is adequate is Oracle. And the entity that's auditing that determination is nobody. If I'm remembering correctly, I believe the last time that Oracle built a detailed profile on people without their consent through Oracle Data Cloud, which tracked browsing behavior and purchase history and social media activity for billions of users, which I talked about in one of my last videos, they had to settle a federal class action lawsuit for $115 million and shut down business. What's different this time is that what Oracle is doing with health data may not even be illegal technically, because the moment data is de-identified, HIPAA steps aside, and the 150 million patients in that platform never never consented, because under the current law, their consent was never even required. Now, there is one document that could answer the most important question in this story, which is, what is Oracle actually allowed to do with your Medicare data? I mean, a federal contract this sensitive should contain specific provisions, right? Like what the contractor can and cannot do with the data, whether re-identification is prohibited, what audit rights the government retains, and what happens if those terms are violated. Yeah, the only problem is the CMS contract with Oracle has not technically publicly been disclosed, or disclosed at all. Like, there is no award notice in sam.gov, which is exactly where that kind of contract should be. The only reason I know about it is because I checked Oracle's blog section and they published a press release about how CMS is their new partner, but not because CMS announced it. So let me be abundantly clear about what I'm saying. We do not know what Oracle is permitted to do with Medicare and Medicaid data for over 150 million Americans. And from what I can tell, not a single regulator is looking at any of it. Oh, well, everybody's so busy right now with the war. And yeah, I know. That's what this whole thing with Iran's all about. And the brilliant part about all of this is the fact that the VA contract is being treated as a defense procurement issue, and the CMS contract would be treated as a health IT modernization issue, and the QHIN designation goes through a different agency entirely. But no single regulator is looking at Oracle's combined position across all of them at the same time. And the office responsible for enforcing HIPAA is being gutted as we speak. The HHS Office for Civil Rights has lost nearly 20,000 employees since January 2025 through DOJ-directed cuts and buyouts and workforce reductions. I mean, the cops are all being fired while the biggest data grab in American history is underway. And now we have a war on top of all of it so that nobody can see all of the things that Oracle is doing at the same time. All right, so what do we do about this now? Well, I know for certain we can't wait any longer. We can't wait for Congress to reform HIPAA because that's going to take years. We can't wait for an administration who has spent the past year gutting agencies to be responsible for protecting you. And we can't wait for someone else to notice, okay? Because I noticed, and if you've watched this video, then you've noticed now too. So we need to get the attention of all of the people who are supposed to be doing something about this. And remember, all of those people are focused on the war in Iran right now. So we have to be really loud. And I'm not talking about calling them up. I'm not talking about writing an email, okay? I'm talking about doing the one thing that always gets these people's attention. Public embarrassment. Listen, I know it's not the most sophisticated answer, all right? But it's the answer that always works, okay? Listen, I've never seen any of these guys do anything that they didn't absolutely feel they had to do. Okay, so here's the plan. I'm gonna start making videos on TikTok and Instagram every day, making comparisons to things we know more about than what Oracle's contract with Medicare or Medicaid says, all right? Because that list is pretty long. We know more about Area 51. We know more about what's in the McRib. We know more about what Coca-Cola puts in a can than what Oracle is allowed to do with all of the healthcare records for 150 million Americans. And I need you to make them too, okay? That's the only way we're going to get the Hill's attention. You can pick anything. The format is simple. You mean to tell me that intelligence agencies have better sourcing on Kim Jong-un's hidden cheese addiction than we have oversight on Americans' healthcare data? On Oracle's healthcare system? Do we know more about the cheese platters that Kim Jong-un likes to eat until his ankles get swollen and they break, which is a real thing that happened, yet you don't know and you don't get to know what Oracle is doing with your mother's Medicare and Medicaid data? I don't know, something like that. You can do it about anything. Listen, we're pooped. We've been working hard, all right? I'm tired. Right, Newt? Never get Newton's healthcare data. And then tag a senator, any senator from the help committee. And look, I know that that part's the most overwhelming. You know, which senator to tag, what's their handle, what you should say. So I coded a little tool to make it easier. Just go to thedredossier.github.io/show us the contract. It'll be linked in the description below, and it's also linked in my Substack. And all you have to do is hit the shuffle button, and it will assign you a senator, and it'll give you their handle. And if you need inspiration, it'll give you a list of comparisons to pull from. And look, I could only come up with 35 good ones, so you'll have to make do with that. But if you mix and match them for different senators, we can make thousands, okay, easily. Or you can make up your own, the funnier the better. Just tag your senator, tag me, and I'll repost every single one of them. The Hippocratic Oath says to do no harm, but Silicon Valley abides by only one oath: move fast and break things.